Okay.
Hey, Poppy.
Yes.
Good morning.
It's not morning.
How are you?
I'm fine, thank you.
How is it being one of the best ICU doctors in Kenya?
First of all, I've moved to administration, and now I'm a medical director. I've been an administrator for a couple of years now. First in Mata, I was a medical director there. Then I was the medical superintendent at Life Care, and now I'm the medical director at RFH Healthcare Group. But I still practice in ICU quite a bit, and ICU is quite interesting. All my patients need me, and it's challenging. There are difficult moments, and there are easy moments. Yeah.
How would you advise people to stay safe at home?
To stay safe at home from what?
From coronavirus.
Coronavirus? I thought you were discussing ICU. Okay.
Yes.
But how is... Okay, fine. So, coronavirus disease, a couple of things you can do. Number one, this thing that you're doing, you should be maintaining some social distance, at least 1 meter apart. Of course, you're in the same family, so it's not so easy. And then secondly is to practice basic hygiene, which is to wash your hands. And you wash your hands for at least 20 seconds with soap. The same things I've always shared with you. Rub your hands like this, then behind, in between, then the tips of the fingers, okay, then the middle of the palm, then the thumb, and you do the wrist. But I'm making a small adjustment. This is what the World Health Organization recommends, but I'm also recommending something slightly different. What I'm recommending is, after this, you realize that this tends to forget a little bit of this edge. So what I'm doing is I'm adding that before you do this, can I call it the Victor Special? Because the whole concept is to make sense. At the end of it, you may do something like this, but as long as you get every area of your hand, it's good enough. Remember, the soap lather should be there for 20 seconds. What else can you do? When you go out with the mask. Do what you need to do, then get back home. Do not engage in unnecessary things that just make you less healthy and less safe. The best way to care for the people you love is to not visit. So if you have Nyanya, for example, visiting Nyanya is not good because you can still give her COVID, and avoid large gatherings where there are very many people in closed spaces. Yeah, and pray a lot.
And how was your first time in medical school?
Medical school was interesting. Of course, there were all these stories that were said. So before you started medical school, you feel a little bit afraid. There's a lot of work, but that's just exaggeration. It's not as bad as people say. In fact, because I didn't work as hard as I could have, it's only medicine that I could have passed easily. I found it a bit, it's easy stuff in a way.
And how was your first patient?
I cannot remember my first patient because by the time I became a doctor, I'd already seen many patients when I was in medical school, when I'm studying. And the time you're studying, I think more about the message, what I'm learning, as opposed to the patient, unfortunately. So you're being taught how to detect. Thank you. You're being taught how to detect a certain disease, how to examine a patient, what questions to ask, and you're wondering, oh, the professor will come and ask me these things. Will I remember? So I don't remember the patients per se. Then, yeah, but I do. I've had a number of patients whom I remember straight from internship. I think there's a lady called Lynette in Kenyatta National Hospital. They weren't very well off, and she stayed there for a couple of months. Partly she was waiting for the family to raise 8,000 to do a CT scan. They waited a long time to raise the money. Then eventually when they got it, we had to do a second CT scan. So she waited for a couple more months to get that done, because those days NHF was not paying for the CT scans. So it's just one of those stories, and she couldn't walk. We thought she had something called transverse myelitis, which affects the spinal cord, and she couldn't walk. And yeah, she was young, in her 20s. That was one of the difficult stories. You look a bit sad. Yeah.
And which masks would you recommend for people to be going outside? The blue ones or the ones that have a plastic thing, or the ones you have right now?
Okay, so there are different types of masks. I thought I had a mask around here.
Yes, it's
It's
behind
right
you.
behind me. Yeah, thank you. So there are 3 types of masks. First, there are the cloth masks that people make out of cloth, and then there's a mask that the one like Mommy has. The one that is blue, it has some pleats in between.
Yes.
And then it goes around the nose, and then there is a mask like this, and then there's a mask with the yellow thing, the one that
Yes,
Mommy has.
like a plastic
Okay.
thing.
So masks in general, for people who are not working in a healthcare setting or not taking care of COVID people, are for protecting the environment and for those around you. For example, if I have a cold and I wear a mask, then when I sneeze, that cold doesn't infect other people. Because COVID, if I had COVID and I sneezed or spoke, and there are droplets that come from your mouth, and those droplets land on surfaces, or they travel to your face or to baby's face. But when I put on the mask, then when I do that, then I'm not spreading the COVID. And if I don't spread to the next person, then the next person can spread to the next person. So that's how we are combating COVID. But also, a special type of mask can protect you from contracting COVID. So if I wear this special kind of mask, then even when you have COVID and you speak and you spit out all these things, it doesn't get into my mouth, and that protects me. But only 2 types of masks can protect you. One is this mask called a KN95 mask.
Yes.
And the European standard for it is called FFP2 mask. The only mask that's better than this one is the actual N95 mask, which is that one that you saw me with, that has it has a yellow thing. Okay, that's called a respirator. It's for breathing out. There's another special N95 mask that doesn't have that, and these masks actually protect the wearer. It's best that these special masks are worn by healthcare people like doctors, nurses, laboratory people, those who work in hospitals, and those who are taking care of people with COVID at home. Right now, there's a recommendation that if you're aged above, I think 65, but I would say above 50, and if you have diabetes or hypertension, high blood pressure or high sugar, or asthma or different lung condition or something that affects you, I recommend that you don't wear the cloth masks, but you wear this mask, because COVID is more dangerous for people who are have chronic illnesses, have pre-existing conditions, and who are of advanced age. So it's best to protect them so they don't catch COVID. Now, the cloth masks do not protect you from getting COVID. So that is the recommendation that we would put out there.
Okay. I understand you're sleepy, so we end the interview here.
Thank you very much, my daughter. This was actually a very nice interview. I didn't think it would be this nice. I hope that our video is rolling, and thank you for asking those questions. Have you learned anything?
Yes.
Okay. Sister, how are you?
I'm fine.
You're fine? Okay.
No, me first.
All right. How was your day?
It was nice.
It was nice. What did you do?
I was playing Major at the night. I was watching the new tire. I was sleeping there.
Okay.
And then I was my sister was going to lead.
All right. That's it. Tell us, say bye. Wave to the camera. Tell them
Bye.
bye. Cheers.
Goodbye.
Goodbye.
Cheers.
So that was my interview. I didn't plan. You didn't plan this. This is my daughter Arianne, who's asked me. I'm just straight from work now to come for an interview. And yeah, Arianne Maggie Hera, Ariela Tello, and that's me, Dr. Victor Ngani. Stay safe. Unfortunately, now stay home is a bit harder than we had said earlier, but protect those around you who are at risk, especially those who are of advanced age, those who have pre-existing conditions. In those situations, maybe you want to get this K95 mask or an N95 mask or something else. I've noticed a lot of poor quality masks coming. Of course, they're profiteers, so they're making very flimsy items, then labeling them. And unfortunately, we would rely on cabs to weed out those kinds of masks. I don't know how effective that or how reliable KEBS is in that way. So yeah, there we go. Let's give it our best shot and let's pray. I really feel that prayer takes center stage in this matter and in this season. That's it. It was the interview. You can tell off send off or a sign off for us to the
I
viewers.
thought you were sleepy and you just added time.
Yes, I was, but then I found the interview very interesting, and I had a chance to respond to a couple of things. Oh, thank you, my daughter. You're so awesome. Love you. Okay.
Okay.
Love you too.
Now we are signing off.